say we get started. Um, so welcome everyone to today's event, a panel discussion on what is resilience, by the way. So this is a conversation where we're asking ourselves and each other the question, what is resilience? And the changing context of our work and the very world part of. So today's panel will commence that conversation. And this session is hosted by the Resilience Collaborative. What is the Resilience Collaborative, you ask? I'll tell you. The Resilience Collaborative is a global community of practice that aims to advance learning and adoption of evidence-based strategies for health worker resilience, particularly in low resource settings. And so I see in the group here, there are many in this session who are already part of the community. And then there are those who have joined here for the first time. So welcome again. For all of you who've just joined in, my name is Ashish Manvar, and I'm part of the TRC host team with the George Institute for Global Health. About this event, this is aimed for to inform and shape our shared understanding about the nature of resilience and its role in the context we all are serving in. And we expect this facilitated dialogue to continue both online and offline over the next few months, leading to more questions, more clarity, we hope, also identifying insights and toolkits, what works, what is changing, and arriving at, among other things, a functional theory of change. So I'll invite you all to subscribe at the website, the TRC website, trc.community, so we can invite you along into the conversation with the community. The focus and doorway into this conversation is healthcare and frontline professionals. And the intent is to invite and include voices, perspectives, and disciplines that touch the frontline healthcare workers. So whether it's pandemics, um, poverty dynamics, planetary health, conflict, institutional leadership, I'd say healthcare is our entryway into the system and the community conversations. So with that said, I'm going to jump into the agenda of what's happening for today. Uh, to let you know, this session is going to be recorded for the benefit of the TRC community. We will be sharing it with people who have not been able to join. The plan for the session is that once I introduce the panel, we begin the conversation, we'll have some time for a Q&A. We'll have a brief moment to discuss some avenues for partnerships and funding, and then the next steps, what's going to follow this conversation. And towards the end, if any of you want to stay back for more conversations, you're welcome to. The host team is going to be there. And now I'm going to quickly introduce you to the panel. This is a significant group, so please be patient with me. I'm going to introduce each of them one at a time. All of the folks on the panel, by the way, are part of this community of practice. They've got diverse experience, perspectives, and some of them also have direct frontline experience. So let me begin with Annette Bongiovanni. Annette brings over 30 years of experience in the global health sector. She's an expert in policy, research, monitoring and evaluation, and health system strengthening, including clinical care. She serves presently as a resilient and sustainable health systems expert at the technical review panel for the Global Fund to Find AIDS, TB, and Malaria. Previously, as Senior VP International Policy Domain at Ipsos Public Affairs, she has collaborated with foundations, academia, donors globally. Annette also served as a critical care nurse in the pediatric and adult intensive care and emergency units. Up next is Courtney Moxley, who's joining us from South Africa. She's the Partnerships and Growth Manager at Reach Digital Health. And she's had valuable experience working with international organizations to address pressing health challenges globally through evidence-based technology platforms. Last year, Courtney managed a WHO project funded by the Johnson & Johnson Foundation to expand the offering of the WHO Health Alert chatbots, which were initially developed to distribute COVID-19 guidance to over 14 million users around the world. Today, Courtney will share insights from this project and its approach to identify healthcare workers from within that audience to target and engage them to build their well-being and clinical knowledge. Dr. Rajesh Parekh, next. He has over 30 years of experience in the leadership and organization development. Means he's the director of Resilient Leadership, an organization which offers services in various areas of resilience, including resilience level assessments, training and coaching on micro practices, first aid and culture as well. He's a certified resilience coach, also a resilience first aid instructor, and a resilience training facilitator from the Global Institute of Resilience and Wellbeing, US. Dr. Parekh is a medical graduate from Nair Hospital and has a master's in psychology. Dr. Dara L. James, she serves as a behavior scientist with the R&D team at Johnson & Johnson. She has over a decade of experience as a research scientist, solving for challenges related to human health, well-being, and resilience. Her passion lies in advancing the understanding of human behavior within the context of healthcare to improve patient-reported outcomes and drive social impact at the systemic level. Dara's got PhD in the field of nursing and healthcare innovation, and an MS in exercise and wellness from the Arizona State University, where she also serves as adjunct faculty. Then followed by Dr. Shilpa Sadanand. Shilpa has over 14 years of experience in the field of mental health in diverse settings, including hospitals, not-profits, and research institutes. Her roles span research, clinical experience as a frontliner, psychologist. Shilpa has a doctorate from the National Institute of Mental Health and Neurosciences in Bangalore, India. Shilpa has led multiple research projects on mental health, aging, dementia, public health, social and behavioral sciences, and disability, and has also developed and run teaching courses. Shilpa also serves as the community manager with the Resilience Collaborative hosting at the George Institute for Global Health. And finally, Dr. Delvin Verghese, our moderator for this session. Delvin is a researcher and lecturer in human-computer interaction at the Action Lab, Department of Human-Centered Computing at Monash University, Australia. So as a social innovation and digital engagement practitioner, his research and practice and advisory work, I'd say, explores the design of technologies to support community engagement in international development. Delvin also works with government bodies and nonprofits internationally, relying on the co-design and participatory methods to design more equitable and digital processes for community development. And his work also has included engagements with Caritas Nepal and Red Cross societies across Indonesia, Namibia, Egypt, Honduras, etc. So having said that, we're delighted to have you all on the panel, and let me quickly hand it over to you, Delvin.
Great, that took a while, but we finally made it through. And I think one takeaway is we have people on the panel who can definitely speak about resilience. So welcome, everyone. As Ashish mentioned, my name is Delvin. I'm delighted to be hosting this section of today's gathering. The next 40 minutes we'll be spending just having a discussion about resilience, and I'm delighted to be joined by these panel members. One of the, we were discussing as a panel before this meeting, the pros and cons of meeting online. The con is definitely not being able to meet together and, shake each other's hands and all the good things that come from that. But the pro is definitely being able to meet people you wouldn't be able to meet otherwise. So I would encourage you to make the most of this opportunity and use the chat. Just type in, your questions, and as our conversations do, feel free to challenge the panel on many of the things they're saying. And if something resonates with you, feel free to encourage us as well and share, how that applies to you as well. I'm really encouraged to see people joining from all over the world, from different parts of the world, whether it's Nairobi, whether it's South Africa, the UK, the US. And many parts of India as well. So welcome everyone for joining us today. I suppose we'll just kick off today's discussion, by talking about resilience itself, So, I just want to go to the panel and say, well, what does resilience mean to you? So I'm just going to start with the panel members here. So I'm going to start with Annette, starting alphabetically. Feel free to share, Annette, what when I say to you the word resilience, what comes to your mind?
Well, thank you so much, Delvin, and welcome to everybody. I want to talk about resilience from a health system perspective, right? Others will be speaking from individual and community level, but I'm going to be focused on a systems thinking lens. And for many years, I've been studying the effectiveness and, excuse me, the quality and the sustainability of health programs and health systems. And it was during the Ebola crisis in West Africa. I work in low and middle income countries, that it became, we were studying, with this measurement model of sustainability of the US government response. But what became readily apparent to me and many other people, as you see now in the literature, is that it was the health systems that were most fragile. It was those countries where they did not fare as well in response to the epidemic of Ebola at the time. And so since then, there's been this a lot of thinking around what are the elements or characteristics of a resilient health system. So that's what I'd like to walk us through right now. So at a very high level, we have borrowed from the physical sciences and the ecology, environmental literature, which, by the way, is more cause and effect than a health system is. But there they look at the outcomes of the system at a very high level. So when you have a shock to the system, and it doesn't need to be a pandemic or epidemic, it could be anything. When you have a shock, excuse me, how well can you deliver the same quantity and quality of health services and functions of your health system with the same amount of resources? That's your absorptive phase. And then going in a little bit of a linear fashion, if you will, what is your ability over time of that system to then transform and use less resources to deliver the same quantity and quality of services and functions, and hopefully in an equitable fashion? And then lastly, the transformative phase. And the transformative would be where you've made adjustments to your health system so that you can sustain and continue to deal with this new external shock. But that's at a very high ethereal level. Let's take it down a bit to a more granular level. And what's really popping out at me, and this does not mean to be all inclusive, but what's really seems to be the four characteristics of a resilient health system. I'm going to walk through those now. You have, first and foremost, information management. And how do you take information and translate that to knowledge? So there's so many steps in between, right? There's the infrastructure, quality, capacity building, and so forth. But how do you get information and data to a point where it's in the hands of the people it needs to be at all levels of the health system to take decisions and use that information so it's not stagnant? So that's one characteristic. Another one, excuse me, is coordination and collaboration. Another real important one that I'm sure resonates with many of you. And this coordination and collaboration is really getting at the interdependency, both within a health system, but very, very importantly, which we saw in Ebola, with all the other ecosystems, with the markets. The closing of the markets in Ebola was a huge problem. With, so the economy, with agriculture, education, infrastructure for IT, all of that basically are intertwined and interdependent. So the more that you make sure that you have already established relationships, that you understand these other ecosystems, and again, bringing it back internally, different departments within a health system, within the ministries, within the Ministry of Health, rather. How well do you know what those other functions are? And do you have stakeholders and people that you can go to when you need something because you've already established a rapport of trust with them? The third is planning and preparedness for uncertainties. Well, by definition, an uncertainty you don't know, but some things you can anticipate, right, with a risk mitigation plan and some of the usual management processes. And indeed, the US government and many donors now, international donors, are putting a lot of money into pandemic preparedness. And what we mean there too, though, is do you have collateral pathways established? Do you have redundancies built in? For example, in the US, we were supposedly to have all these PPE, personal protective equipment, ready for in the event of a pandemic, but we didn't have enough. So that's basically, do you have your plan B, and are you ready for the plan C that you didn't even know you needed? And then lastly, and this one will resonate, I'm sure, with many people, is leadership. And it's leadership at all levels. It's not just the president of a country who is in denial that Ebola has hit his country and carries on business as usual. Or it goes all the way down from that political will at the top to the village level. And to give you an example, we had a series of learning fora in different countries. And in Sierra Leone, we had found out about a woman way in the rural village who had never had a formal job before in her life. And she had lost her son, her mother, her cousins, and her friends to Ebola. And she decided she was going to do something about it and became a councilwoman. And we invited that woman to come to Freetown and speak. And she was a powerful leader. And the characteristics of this leadership is that it's inclusive, as I've been demonstrating now, and that they have a clear and shared vision, and they're visible and they're available. So I'm currently working on taking these conceptual frameworks, trying to distill them, but importantly, we need to now operationalize them so we can measure them. And that will provide meaningful information for programmers and policymakers alike. Thank you so much for your time. Over.
Thanks for that, Annette, and really sharing from a high level. And there's a lot to unpack there, and I'm sure we will during the rest of this panel. So moving on alphabetically, I'm going to move over to Courtney. You're next.
Thank you so much, and thank you for having me on the panel. I'm speaking from Reach Digital Health. I'm based in Cape Town. I just wanted to tell you a bit about what Reach does. So we build digital platforms that help to impact health behaviors across a variety of different health domains. Previously in the past, we would give users a lot of knowledge information in a browsable format. But we realized ultimately that just giving people knowledge isn't enough to affect behavior change. So over the last year or so, we've been changing the way that we are approaching our digital interventions to center around this idea of persistence. So persistence is our big keyword in our theory of change at the org. And the reason I'm telling you this is because while preparing for this panel, I was actually thinking a lot about how resilience is actually a foundational block for persistent healthcare behaviors, which I thought was quite an interesting way for me to think about that. So persistence is all about impacting health in the long term. We're trying to drive persistent behavior change with the ultimate goal of improving clinical health behavior outcomes. So in the slide that I have prepared for this, there's 3 components of the health system that we focus on. Similar to Annette, we're taking a high-level view of the healthcare system, and we impact people at the citizen level, the healthcare worker level, and at the decision-making level. So resilience impacts all 3 of those levels, and our working definition for resilience is really the ability of these different domains to adapt and persist in the face of challenges, stresses, and adverse conditions and difficult working conditions. So this is why I say that resilience is a foundational block for persistence, because you need to be able to adapt to the changing environment around you in order to be able to build these persistent health behaviors that lead to positive longer-term health outcomes. So in my bio, it was mentioned that we've been working on a project with WHO over the last year that was to expand our offering to healthcare workers to help them build their resilience. And obviously, it's critical to be able to build resilience for healthcare workers to enable them to maintain their well-being while coping with, demanding work conditions. Our aim was to improve their job satisfaction and retention, and ultimately to improve the services that they provide to citizens accessing the health system. And ultimately, by improving health worker resilience, therefore, we can improve patient outcomes in a variety of different health areas, including their own resilience. So it's very much, I hope that this image captures that it's a very intricately linked system of resilience and persistent behaviors. And then obviously among citizens, because we targeted them as well on this chatbot, resilient behavior among citizens looks like being able to navigate a complicated healthcare system. We've got people who are more empowered to manage chronic illnesses and also to prevent mental health illnesses. So these were just some of the areas of resilience that we focused on. But I really just wanted to reiterate that resilience is a core determinant of being able to adopt persistent long-term behaviors long after digital interventions are served. And this is for citizens and healthcare workers. So ultimately, to have these long-lasting impacts on health outcomes, resilience is really a core feature there. Thank you.
Thanks, Courtney. And I really love the emphasis on the assistant healthcare behaviors. So, you know, for me, that really meant the sustainability of the changes long-term and involvement of people at different levels. Fantastic. So alphabetically next, I'm going to pass over to Dara from Johnson & Johnson. Over to you, Dara.
Thanks so much, Delvin. Really happy to be here today. Grateful to be part of this amazing panel. One of the things I immediately liked about the panel so much is that we all have our different perspectives and we're all bringing something different, a different angle, different view, and kind of a different story with our resilience experience as well. So I'm just going to share briefly today about how my personal experience with and relationship to resiliency informs the work that I do in the professional healthcare workspace. So I do a lot of work in the academic space and also in industry with healthcare workers around resiliency, well-being, health at an individual and community and systems level as well. More of the work that I've done has been around individual, like how do we give people the resources to be able to build their resiliency? And I think backing up, I've been thinking about this a lot since the invite for resiliency because I feel like it's something I do, but I don't think about very often. So it's been a very welcome opportunity to kind of pause and reflect on what resiliency really is to me. And I think for me, it's really about showing up for myself, you know, continuing to show up for myself and other people in that space. I think, you know, as we all know, adversity begets resiliency, and it's oftentimes, you know, built and explored from that space. For me, when I think about concepts around resiliency and compassion and well-being, these are practices for me. They're not an endpoint. They're not something that we can get through a certification or weekend training, unfortunately, but they're actually practices and what I call a return to practice. So a lot like, you know, developing a muscle or training in something else, it's something that we have to come back to again and again. And one of the things I'm really interested in is the dynamic between the individual and the environment as well. So whether environment is a household or a healthcare system or a community or workplace environment, I'm interested in how we can support both and not put the onus on one or the other, but have it be a very mutual building relationship. I think that's a really important piece. And then, you know, I'm a researcher, so I dove deep into like all the different operational definitions of what resiliency means. And we don't have one yet. So, but that kind of makes the field, you know, exciting and again, gives some fluidity to it and certainly ongoing discussion. I think one of the things that feels important to me, very much aligned with the work I'm continuing to do in the resilience space and certainly believe in for, you know, human health and well-being, is that our definition includes adapting well or adapting in a well-being space. So I think oftentimes that wellness piece is missing and we talk about adapting and growing or learning and growing, but without the adapting well piece. And so that's something that I've been doing similar work on and certainly exploring myself more personally, because certainly there are ways that we can adapt that are not, you know, supportive of where we want to go with resiliency. So I think including that little piece, that little magic piece there around wellness or well-being is important when we contextualize what we're talking about for, you know, kind of the operational definition, the high level, and then the detailed, you know, components that are in a definition of resiliency. So I'm very happy to be here and really excited to hear others and to have a discussion with everyone in the room today. Thank you.
Thanks, Dara. And yeah, you definitely shared a unique perspective on resilience today. And I very much echo what Ashish was saying at the beginning, which is this is about, going on a journey together. This meeting really is an invitation to design what resilience is, because that's what the collaborative here is, isn't it? And I think it, even what you just mentioned about well-being, I think it, and the next speaker we have is Rajesh here, so it's the perfect person to speak about that. So I'm just going to hand over to Rajesh Parekh now.
Yeah, thank you so much. It's really a pleasure to be with everyone today, and I'm very happy to be on the panel talking on a subject which I'm really passionate about, and that's resilience. So what is resilience for me? So when we talk about resilience, resilience for me is a mindset. It is a mindset which is actually described by 3 A's. The first A is accept. So yes, when we develop this ability to accept that, yes, there is an adversity which has happened, that is the first step towards moving towards handling, becoming more resilient. The second step is, the second A is adapt. And now I've changed it to adapt well after listening to Dara. So adapt well so that we are able to adjust, adapt to the circumstances which have now risen, and we are able to see how is it that we can deal with those circumstances. And the third A is to advance in life, advance towards the goals which you have set for yourself, advance so that you can thrive in spite of the adversity which has happened. And I think when we accept, adapt, and advance, we are having a resilient mindset. So for me, resilience is a mindset. And over the years, I've also realized that when we try to define, when we try to understand exactly as to what is resilience, I have a simple formula for it. So I say stress is equal to divided resilience. Okay, so whenever a person has pressure, if the person has enough resilience, then the person will not experience stress. But whenever the person has pressure and does not have or has low resilience, then the person will definitely succumb to a lot of anxiety and a lot of stress, which can then lead to various medical conditions, etc. Okay, so for me, resilience is a mindset. Thank you very much, everyone.
Thank you, Rajesh. Yes, I wonder how many of our audience members echo with that, because, and especially as what we were hearing from, Dara as well. As individuals, we've all had to wrestle with our own notions of resilience, whether or not we have resilience in our job titles or not. And well-being is a big part of that. And yes, we will definitely go back to some of what was discussed later on and expand on these points. So thank you for adding that in the comments. And I think there's a comment addressed to Dr. Rajesh there as well. And last but certainly not least, we're joined by Shilpa, who is very experienced in the space, and and I'm looking forward to what she has to say, particularly wearing a hat of mental health and the work she's done in the NGO space. So over to you, Shilpa.
Thank you, Delvin. I think most of the definitions and most of the discussion has been already covered, so that gives me a tougher job as to what to say now. But I think I wanted to say something different, but I will say something very personal, meaning as to when did I really give a thought about resilience although being a mental health professional. So 2009 was the first time when I started working as a psychologist in a hospital care, but seeing patients day in and day out, but never really thought about resilience, but always thought about well-being. But I think when I was on a personal journey, going through to early pregnancy loss, and one of the physician who was not from a mental health professional made a comment saying that, oh, you're so brave and resilient. So that was the first time I was really taken back, and then, okay, this is someone who's a physician, not from a mental health background, but says that, you're being so resilient. So that was, I think, first time I really remember that, I really got interested in this field of resilience. So coming from a psychological background, of course, one of the definite definitions I follow, and if we are looking at research literature and evidence, and as a community, if we want to develop interventions, one of the definitions I would definitely look into is from the individualistic perspective, the psychological resilience, but not stop at that, but also consider that, resilience is a more complex construct. It could be, on a personal journey, it was not only about my behavior, but the relationship I had with my family, the community where I stayed in, the organization support I had, and also the invisible support system what we have. Like, I'm sitting in a cozy room with the AC on. We forget that we're quite privileged to have that. So having that as a background, the social, the political, not having a conflict in the country I live in, is also very important when we think about resilience. So coming from a very individualistic perspective, but also thinking about the invisible, the so taken for granted support systems, what we all have, I think that's what resilience means to me. So I'll stop there. Thank you.
That was a beautiful definition, Shilpa. I think you rose very well to the tough job that you had. And definitely, yeah, echoing that, there's often this emphasis on the individualistic aspect of resilience, but we forget that, the reason we can focus solely on the individual is because so many of the other aspects are taken care of, by living in a stable economy or, yeah, so many other things. Yeah, so thank you so much for that. And the audience, I can see there's a bit of a to and fro requesting of resources. Please feel free to yeah, add in your own thoughts. We just don't want to talk to ourselves here. We want to hear from you as well. What does resilience mean to you, in your own context? Maybe something over the last few years during the pandemic taught you something about yourself, or how you viewed the word resilience. We're really interested to find out more. But as I wait for those responses, I'm just going to move on to the next question, which we'll do more as a back and forth rather than as a one by one. And this question is, what definitions or frameworks do you use within your organization or your practice in the work that you do? Okay. Now, a simpler version of this question might be, what's your working definition of resilience? If someone on the street stopped you and said, what do you mean by resilience? And, how do you use resilience in your own work? That's the question here. So I'm going to make it easy for the panel by going first to the people who have resilience in their job titles. So I'm going to go back to Rajesh first, and then we'll continue the discussion and have a back and forth between the panel.
Sure, thank you very much once again, Delvin. As far as definition is concerned, I would like to define resilience in 3 simple words. And those 3 simple words are: resilience is developing the ability to advance despite adversity. So I define resilience as advancing despite adversity. So whenever we develop the ability to continue to advance towards the goals which we have set for ourselves, that is indicating that we have now developed resilience. Within my organization, we believe that resilience runs across a couple of domains, and we believe in a very strength-based approach, not a deficit-based approach. Generally, what people do, they have a deficit-based approach. We wait for the problem to happen and then we offer solutions. So what I would like to do is offer a strength-based approach where we look at how is it that we can strengthen the 6 domains which we have identified for resilience. So what are these 6 domains? The first domain is composure. That is the ability to remain calm and composed in any situation which comes up in front of you. So that's the first domain. The second domain is vision. Vision, the ability to ensure that you don't lose sight of what is it that you really want to achieve. That's the second domain. The third domain is a domain which we call as reasoning. Reasoning simply means the ability to solve problems, the ability to anticipate them also, and the ability to see how is it that you can become so resourceful so that you can solve any problem which comes up in front of you. The fourth domain is about health, where we look at how is it that we can help them improve their diet, their exercise, as well as help them sleep well. Now, according to us, this is a very foundational domain. And as Dara also mentioned, wellness is a part of this particular domain. The next domain, the fifth domain, is tenacity or persistence. That is where comes bouncing back, the ability to bounce back from adversity. And finally, the last domain, last but not the least, let me tell you, the last domain is all about collaboration. It's about connections. It's about developing your social network in such a manner that as and when we have any problem or any issue or any adversity, we are able to take support of this support network and see how is it that they can help us through the adverse condition which is there. So if we are able to focus on strengthening these 6 domains, then we are able to offer something which is a very strength-based approach. Yeah, and we are able to prepare people to be able to handle adversity as and when adversity strikes, because we never know when adversity is going to strike, isn't it? So it's very important for us to prepare ourselves in such a manner that we are able to be ready when adversity strikes. Thank you.
Great, thank you. And I wonder from a systems perspective, Annette, what would you say about these domains? You know, do you see a direct implementation that's possible from that framework that Rajesh has just presented, or do you see some of these need adapting when you're thinking about from a global health or assistance perspective? I'm keen to hear your thoughts.
Yeah. Well, first of all, there's a lot of similarities with what Dr. Rajesh has just said and what I spoke about earlier, right? This ability to absorb the shock, adapt to it, and transform. That's very similar. But I want to pick up on what you said, Dr. Rajesh, about the strengths approach. I've been for about 20 years now leading international research divisions, right? So I want to talk just a moment about how I do it with my own teams, because I realize it's very similar to a systems level at a division level with a group of people. And I'm a big proponent of having pause and reflect times that are scheduled, where you just clear your schedule and you have a retreat. And basically it's strengths based. And so there are different tests you can put out. They're not really tests, they're like ways of coding, right, that you find out what your personal strengths are, because that's what you can work with, right? And then it helps us to organize teams, to know how to work with each other. And then as you're moving along, basically what I use as a manager are the same types of elements, like communication is key, sharing information. I haven't seen managers work well when they keep information to themselves. Coordinate and collaborate, build trust. I was doing a study on trust last year. Trust is a big topic right now. You don't just get trust when COVID hits, right? You have to have had those relationships all along. Planning. I'm a huge planner. Some would even argue I plan too much. And leadership. To me, leadership is not the person who's leading the division. A good leader looks for the leader in everyone. And I often will ask my staff and they'll say, well, I'm not really a leader. And then I can always find something in them where they are a leader, and it just gives them a different perspective. So there's a lot of convergence around what Dr. Rajesh said, and between systems and also teams. Thank you so much for that question. Over.
Great, thanks, Annette. And yeah, something brilliant that I just read in the comments as well from Nisha as well, about resilience being, this strength that is there within us, quite a lot of the time that we just tap into, and over time, as we use that more and more, it builds up and increases. And I think many of us will relate to that as a working definition. But I just wanted to throw over to Shilpa, just from her own, not only has she shared a personal experience of resilience, but her own, the hat she wears around being a mental health practitioner. What do you see in that definition? Do you endorse that? Would you add anything to that?
Yes, definitely, Delvin. I definitely can relate to that. But like but one of the things I thought about when that comment arose uh, is that we might have high resilience behavior, but may have very low well-being. So it cannot be that we are very highly resilient and high on well-being. So it is both ways. Someone who is very high resilient could be from a very poor socioeconomic background and have a low well-being, and vice versa. Someone who's from a low resilient behaviors, living in a very developed country, can very have high well-being. So that's the immediate thought I had about resilience, well-being, and then looking at from a very individualistic perspective. Yeah.
Yes, it's one of several qualities, and in that explanation you've just given us, resilience and well-being could almost, you could have high resilience, low well-being. So it's almost like a quadrant of sorts, where you could have people in one of four different places. But then if you add other qualities into the mix, it becomes very multidimensional very, very quickly. But
Yes.
yeah, so it's a very interesting perspective. And just wondering from a kind of a global health perspective, and I know some of the work that Courtney was mentioning earlier, working with the WHO. What is the role of technology in this space? You mentioned the use of chatbots, and other technologies that aim to reach the masses more efficiently. What would you say is, innovation and technology playing a role in building up resilience, or, leveraging people's existing resilience here?
Thank you for the question. And yes, we're sitting on the cusp of being able to use technology to address so many of these issues. That comes with positives and benefits and downfalls. Obviously, there are risks associated with using digital platforms for things like mental health, because you can't always offer the correct interventions. You need a lot of support on the ground to refer users to, for example. And then there was another point that I saw somebody raised in the chat, which is about we have little control over the environments in which resilience is brought out of people. So asking people to be resilient actually puts a lot of pressure on people, our users on these chatbots, to be accountable for their mental health and other effects of their environment when it's actually out of their control. So on one of our platforms, we've had to shift to focus more on well-being than resilience, just because it is easier to support people's well-being rather than resilience through a digital platform. But I just quickly wanted to speak about this complicated diagram. This is basically the foundation of our theory of change through all of the chatbots that we build. I've spoken about how resilience is an underpinning of persistence, which is our core area. But basically, what those words mean is building empowerment of our users. So giving them the ability to manage their health themselves, to give them the knowledge and the skills that they need to adhere to treatment practices, for example, to continue visiting the clinics, things like that. So there's words highlighted in yellow here, locus of control. So it's often experienced in people as a feeling of being in control of their own health. So that is really what we're trying to achieve through our digital platforms. This structure is based on the COMBI model of behavior change that acknowledges that there's a lot of factors that affect people's behavior change, like psychological factors, environmental factors, their motivations, fears, risk assessments, things like that. So this diagram assesses each of an individual's different barriers to a persistent health change through these three different areas. The first dark purple one is we first assess risk factors. So, for example, gender might be a factor that already puts people at high risk for not being adherent to certain practices for their health. So we give them an intervention based on those risk assessments. The lighter purple one focuses on personal barriers. So for example, mental health issues or any other personal things that could impact your ability or motivation to change your behavior. And then lastly, the yellow is user segmentation. So we give people different interventions, we give them different content depending on the environment in which they find themselves in. So an example might be a healthcare provider is very time constrained. So we need to give them a very different intervention to a citizen or a different kind of health provider, perhaps different for community healthcare workers or a nurse, for example. So this diagram just shows that there's lots at play in determining how we impact people through chatbots. And yeah, using it as a tool to drive behavior change, persistent behavior change. Thank you.
Thanks so much for that. And one of the things I've been really wondering through this discussion is, it feels like COVID-19 has almost been absent. Because we've been talking about resilience, but obviously it's really shaped and colored our perception of resilience, especially for the masses at large. And I just wanted to throw to Dara and just hear a bit more about that. I wonder if we look at Google search trends results of the word resilience, how much that's in a sense spiked since 2019, and now it's a part of everyday lingo, isn't it, for a lot of people? What do you see in that? Is that for the better that more people are talking about resilience? Do you see that as a jumping point for further conversation, or do you think that the words become diluted as a result?
Yeah, it's a great question. Thanks, Delvin. Would love to hear what others think about this as well. But I always think when there's a word that, like resilience, it certainly can get overused. But I think in this capacity, it's really brought light to it, and it's opened up a lot of space for conversation and discussion. As point in case right now, in this discussion that we're having. So. One of the things that I think, and this kind of goes back to some things that have been said with respect to in the context of COVID, this idea of like a strength-based approach, a mindset, resiliency is kind of a way of being. One of the things that I'm really interested in that I think COVID taught us is, how do we teach people resiliency before they need it? Because it's kind of, we get to this point and there's something like a pandemic or, a natural disaster or even a personal trauma. And then we kind of learn resiliency that way. And I think COVID taught probably many of us globally, and just kind of in a crashing way and a sudden immediate need for resiliency in those skills that we might not have necessarily had, but had to figure out very quickly. And so I do think there's huge value in continued conversation. And I think sometimes, it's the idea of, adversity, bringing light to resiliency. And I think COVID did that. In a positive way, a silver lining, these discussions around well-being, community resiliency, compassion in the healthcare space. And then I think it, definitely brought to light the systems level approach of needing resiliency from the individual to, the global sphere. So I think that, I think it's given us a real opportunity. And I do not believe it's become a diluted word. I think it's become a more ripe word in terms of more, more room for discussion, more interest in the exploration of what it is, and then hopefully the application and practices of it as well. Thanks, Devlin.
That's great. Thanks for sharing that, Dara. Yeah, I definitely agree with that. And yeah, I don't know about the rest of the people here, but I've learned so much from this discussion, and the time has gone by so quickly. It's already been 40 minutes. We've only got 10 minutes left in today's webinar. So, some of the things I learned today, resilience is more than the individual component. Resilience is about the collective. It's about there's so many other aspects of our lives, our environments, as one of the panelists shared, that we take for granted when we think about resilience in an individual setting. I also really enjoyed learning about the different metaphors of resilience. The bouncing back, and in the chat I saw someone mention this example of bouncing balls, and it turns out one of those balls was made of glass, so which led to an interesting discussion in the chat with Annette as well. looking at different, resilience in different settings, like, NGOs, global health, and that has different ramifications. And yet it shares some of the, same dimensions and, models of resilience as we use with individuals. There's so much in this discussion. We will make the recording available. Thanks to all the panel members for taking part and sharing vulnerably, sharing their stories, sharing from their deep experience, and and we got all this for free, which is amazing. So I'm just gonna hand over to Varadarajan, who's going to be taking over for the next part of the meeting and sharing some exciting calls for funding opportunities. And so thanks again to the panel members. I'm just going to give a virtual clap. And yes, moving on.